Yeah, so public health works very closely with all kinds of businesses, and really it depends on several factors. So, for example, if someone was not at work and became symptomatic, and public health was able to confirm that they were not at work while symptomatic, there's no issue for any case contact investigation or follow up at the place of work. If someone was working in an area where there were just a few other employees, routinely there's an assessment made that were all employees or only some close contacts, and if they were, they're just given some general information, or all employees are given some general information, and if someone was a close contact, that close contact may also have to isolate for 2 weeks and seek testing if they're symptomatic. If someone was either working or visited in an area where other members of the public were visiting, then if there's no way to contact everyone who may have gone to an event, then a public service announcement is given, and that's just to say that potentially if you went to these businesses on these dates because someone else was there, you may have been exposed, but the risk generally would be low because we already learned that we really don't see transmission in retail environments, so the risk generally is low. But there is a public service announcement given, just for awareness, and we've seen even with air travel, for example, that we always announce flights. But and again, this comes to the airborne question that aircraft have very high air exchanges. So even though we always announce flights and all that, I'm actually not aware of any transmission that's happened to date in flights due to someone who was infectious while traveling. So I think that's a positive thing, that, and especially if people are wearing masks while traveling, for example, transmission risk is low. But there's some intent to inform the public that they would have been in an area where there was someone who's infectious. But again, if people are maintaining that 2 meter distance, hand washing, wearing a mask, if they can't maintain the 2 meter distance, the risk of transmission goes down even further. So even if there is a PSA, you need to be aware, but chances are if you're complying with everything else, your risk of exposure would be very low. And certainly we have not seen transmission in a lot of those settings in any case. Transmission is a function of how close you are to someone, how long you are close to that person. For example, in a social setting at home, you may be together for hours, around food and drink. So those are the settings where transmission risk is higher. And if you just pass by someone even closer than 2 meters, passing by someone in an aisle, for example, generally the risk of transmission in those settings is much lower. So public health is involved with the businesses whenever there's a case associated with a business which may be close to the public or open to the public, and it really depends on the setting and what the person who may be a customer or an employee was doing. And so appropriate steps may include cleaning. Generally, closing a business is not required, are taken. But certainly, generally, we know that the virus may live on a surface, and that can be cleaned very quickly. And that's not really the setting in which transmission happens. Really, it's close face-to-face contact. But because COVID is a notifiable disease legally under the Public Health Act, public health is always involved and works with businesses, and the decision to issue a public service announcement is a public health decision, not a business decision. But again, I have to emphasize that, and I said that earlier, that individuals or businesses or communities sometimes feel quite under the microscope, and I think we need to get over that now, because COVID is not an unusual emerging illness like it was in March. It's something that many of us will unfortunately get exposed to over the next few months, and we need to keep our case numbers low. If you're exposed, or if you're at a business, or we run a business where there was a case, we just need to deal with it in terms of if there's a need for public service announcement. There shouldn't be any stigma or shame or finger pointing in this. It's just one thing that, just like we do with other infectious diseases, it's something that we have to normalize for the next little while, that we just need to go through the processes to make sure everyone is safe and everyone is informed. And we shouldn't treat COVID differently than we do with anything else, E. coli infections or measles infections. We just need to have the same approach, really.